Hello everyone, I'm Mr. Furlong, and today we're talking about the anatomical position. In the study of the human body, we use all these new terms. It's like a whole new vocabulary. We like to refer to it as the anatomical terminology. Today we're going to be focusing on specifically the anatomical position. This is a person who is standing, they're facing forward, their arms are outstretched, and their palms are outward. So whenever we say the front or the back of something, or the right or the left of something, it's always going to be based on anatomical position. Now this may seem pretty simple, but oftentimes mistakes can be made. For example, there was a doctor in Florida who had to amputate a person's right leg, and because of the position that he was in, things were kind of flipped around and he actually amputated the wrong leg. And the person had to, when they realized this, had to, of course, get his other leg amputated. So this person now had both legs amputated instead of just one. So just imagine what that lawsuit cost the hospital and the doctor, all because of a simple mix-up. And so nowadays in hospitals, you'll see that they will check and double check and oftentimes triple check to make sure that these simple mistakes aren't being made. So we're going to look at this anatomical terminology. We're going to take this in pairs and we'll show you a couple examples of each of these. So for example, we have superior and inferior. Now superior means above or closer to the head. Inferior means below or farther from the head. In this example, the superior vena cava, which is right here, is above the heart. The inferior vena cava is below the heart. Anterior means front, posterior means back. So for instance, we have all heard of the anterior cruciate ligament, right, or the ACL. Well, right behind it is the posterior cruciate ligament. See how they do that? Front, back. Medial means toward the middle. Lateral means toward the side. So you know in your ankle, those two little balls that kind of stick out from the sides, they are actually called the medial malleolus, the one on the inside. The one on the outside is called the lateral malleolus. Proximal means closer to the point of attachment. Distal means further from the point of attachment. So here we see a microscopic structure in the kidney. We have a structure, this round thing here called the glomerulus. Well, there's a tube that runs from this glomerulus. The first part is called the proximal convoluted tubule because it's closer to the point of attachment of the glomerulus. Farther along, we see the distal convoluted tubule, further from the point of attachment. And lastly, we have superficial or peripheral, which can mean near the surface, and deep, which means more internal. So for instance, here we see some of the muscles of the back. We have the superficial muscles, the ones that are on top, and then there's a whole set of muscles below them. Those are the deep muscles. Once we start dissecting the cat, we'll be looking at both superficial and deep muscles. Those are just a few of the anatomical terms, but these are the ones that we're going to be using a lot. So you'll see these often. By knowing these terms, it will help you immensely in learning the anatomy. And I'll see you in class.